So hi everyone, my name is Ashely Willis. I'm a third-year pediatric resident at Our Lady of the Lake Children's Hospital, and with me I have Nuss, who is one of our chief residents. We'll be presenting today on why triage is important during the COVID-19 pandemic. We have nothing to disclose during this presentation. Some objectives of the presentation include defining triage, understanding the importance of triage and workflow, and identifying strategies to triage and eliminate the risk of transmission. So triage is the prioritization of patient care based on illness, severity, prognosis, and resource availability. During infectious disease outbreaks, triage is particularly important to separate patients likely to be infected with a pathogen of concern like COVID-19. The CDC standard operating procedure for triage is developed in the context of the COVID-19 pandemic and does not replace any routine clinical triage already in place in healthcare facilities. There are several limitations to consider during triage. Some limitations include the limited number of patient rooms, the ability to follow cleaning protocols, and the ability to provide safe areas to separate sick and well patients. It's important to update triage processes. Some pediatricians can consider separating providers for sick and well care, and it's also important to have the appropriate PPE for both well and sick visits. Pediatricians can consider replacing self-scheduling for acute visits with nurse triage conversations, whether that's via phone or secure chat. And walk-in hours for acute visits may have to be replaced with walk-in virtual visits. Telehealth can be a timely and cost-effective mechanism of triage. It can be used to provide acute care for many conditions, enhance triage, patient and family education, and close follow-up. Limited physical exam components are one example of how telehealth may not be optimal for every patient encounter. It is possible, though, to turn a telehealth visit into an in-person visit at any time when appropriate. The AAP strongly supports continued access to healthcare for children and teens during the COVID-19 pandemic, whether that be in person or via telehealth. There are some encounters that do require in-person care, including the initial newborn visit, comprehensive physical examinations, office testing, hearing, vision, and oral health screening, fluoride varnish, immunizations, and any potential for the patient to decompensate. Patients presenting with symptoms suggestive of possible COVID-19 can be assessed initially via telehealth to clinically evaluate, counsel, and educate on COVID-19 or refer for appropriate testing. There are several considerations for in-person appointments, including those that have the possibility for an increased risk of severe illness from COVID-19, including those with congenital heart disease, obesity, diabetes, asthma, chronic lung disease, sickle cell disease, and immunosuppression. It's important to not penalize these patients for canceling or missing appointments because they are ill.
Hi everyone, my name is Nuss. I'm going to discuss preparing patients for in-person visits. When scheduling appointments for routine medical care, we should instruct our patients to call ahead and discuss the need to reschedule their appointments if necessary. If patients have symptoms of COVID-19 within the last 10 days prior to their appointment, if they have been diagnosed with COVID-19 within 10 days prior to their appointment, or if they have had close contact with someone with suspected or confirmed COVID-19 within 10 days prior to their scheduled appointment, we should consider rescheduling. Physical distancing for in-person appointments. We should limit visitors to the facility to those essential for the patient's physical or emotional well-being. We should schedule appointments to limit the number of patients in waiting rooms or create a process that patients can wait outside or in their vehicle while waiting for their appointment. We should arrange seating and waiting rooms so patients can sit at least 6 feet apart. This is an example of a way to help prevent the spread of respiratory diseases like COVID-19. We should remind people to stay at least 6 feet apart, about 2 arms lengths from other people. We should remind our patients and family to cover their cough or sneeze with a tissue and then throw the tissue in the trash and wash their hands in between. When in public, we should still ask people to wear a mask over their nose and mouth. Remind people not to touch their eyes, nose, and mouth. We should clean and disinfect touched objects and surfaces frequently. Remind people to stay home when they are feeling ill, except to get medical care. And remember to wash hands often with soap and water for at least 20 seconds. Triage in the inpatient setting. If admitted, place a patient with suspected or confirmed COVID in a single person room with the door closed. The patient should have a dedicated bathroom. Airborne infection isolation rooms should be prioritized for patients who will be undergoing aerosol generating procedures. To the extent possible, patients with suspected or confirmed COVID should be housed in the same room for the duration of their stay. We should be minimizing room transfers if possible. We should consider designating entire units within the facility with dedicated HCP to care for patients with suspected or confirmed COVID-19. We should also determine how staffing needs will be met as the number of patients with COVID infection fluctuates or more recently increases. There are some strategies to eliminate the risk of transmission. We can limit transport and movement of patients outside of the room to medically essential purposes. We should communicate information about patients with suspected or confirmed COVID to appropriate personnel before transferring them to other departments like radiology, for example, or to other healthcare facilities. Patients should wear masks to maintain secretions during their transport. Family members and caregivers should be allowed to be present in a limited number with their children who are hospitalized. All family members and caregivers who are present with pediatric patients in the hospital must wear masks or face coverings when outside the patient's room, and we should encourage them to do so while we are in the room. Family members and caregivers who are symptomatic or found to be COVID positive should not be present with their pediatric patient in their hospital room. An alternative caregiver who is not symptomatic or positive for COVID should be identified. In closing, we should continue to utilize telehealth and triage protocols to reduce exposures for other patients and healthcare personnel. We can help prevent the spread of disease within the facility by doing so. We can help ensure PPE is used effectively. We should utilize physical distancing and patient placement strategies to prevent the spread of infection. Family presence policies are crucial for providing family-centered care for children, and team huddles can be very helpful in certain instances outside of the room.